Chief, when you originally stated you're closing the Clayton Fire Station, is it better to say that you're releasing the crew and that the station remains and it'll be manned 25% by a Concord fire crew? Is that correct?
I would say that the apparatus or the unit is being destaffed.
Right.
No longer staffed on a 24/7 basis, and that we're sharing that resource between two communities on about a
Right.
75-25 split.
And that effectively means that Concord, in addition to having a station closed in July, we are now having a station cut by 25%. Is there any other city in the group that has had 2 fire stations affected?
Yes, sir. The city of Walnut Creek has
Had 2.
a fire station closed as well as a unit that was destaffed.
Okay.
And of course, Clayton only has 1 fire
Right.
station, and they're losing that.
There was a lot of discussion about a change of model for the fire department to include, instead of 3-man fire crew chief, to use a EMT or paramedic combo, ambulance style, so as to handle the 70% or so medical calls. If this was implemented on 2 or 3 stations, would that save a closure?
There was discussion at the board meeting today about, and I think it depends on what type of model people are talking about. There was some discussion about going to a 2-person engine company where they would still have full fire suppression responsibility, but there would only be 2 people on that rig as opposed to 3. Personally, I think that is an unsafe model. I don't think that it's adequate staffing. The national standard calls for 4 people on each rig. We currently have 3 people on each rig, and we have a very lean organization with a very low baseline to begin with. I think it's a safety issue for our people. The other thing that if we tried to redistribute those people is that it's not just one station arriving for an incident. Whenever we have a structure fire, vegetation fire, or a rescue call, it takes multiple units to be able to mitigate that emergency. And right now we have, as an example, for a structure fire, if one were to happen here in Concord, we would send the closest 5 units, and the national standard is that we have 15 personnel to be able to conduct all the tasks that are supposed to be accomplished on that structure fire. If we go to 2-person units, now instead of 5 units, we need to pull 8 units from the surrounding area, and it takes much longer for them to get there and develop that adequate firefighting force.
What I was getting at is, though, you would still have your 3-unit firefighters, all right, and then you would have a two-man EMT response. It would be sort of like the difference between having SEAL Team 6 to fight your fires, and you have G.I. Joe, no offense, Major General, to take care of the medical. And you would still have, the idea is to have a mixed force so that we have ambulance crews, not fire trucks, ambulance crews to respond to medical, and firemen still could respond to the fire. And the overall idea is to protect our response rate. And since our response rate is so critical on the medical side, all right, is it not appropriate to start building up the EMT model so that we can protect our response time for the overwhelming majority? And is it correct that the EMT model of a 2-people EMT, not trained to walk through fire, is a much cheaper model? And where are we in developing that?
Right. We actually discussed that as a potential alternative to some of the stations that are being closed. In other words, and just for clarification, the fire district cannot operate ambulances. There's exclusive operating rights for transportation units. So we can, excuse me, we can staff, as an example, first responder type units with medical personnel that I think are accomplishing what you're asking us to do, but we can't operate ambulances and we can't transport. that was a solution, one of the solutions that we are going to continue to explore and see if there is a less expensive, potentially civilian EMS only, civilian as opposed to fire personnel, EMS only type of system. Now, it was proposed for the potential 4 fire stations, you know, to be able to help fill a gap for those 70 to 80% of our calls. But it's also possible that a system like that could be put in place in addition to the engine to help offset the response to medical calls, which, you know, as we said, continually challenge the system. So we are exploring that. We have to bring a report back to the board. The other thing is that today the board authorized the county EMS system to conduct another analysis of EMS delivery in the county. The last one was done approximately 10 years ago, and they're going to have an outside consultant come in, do the analysis, look at best practices, and there are also some serious concerns in the future as far as the healthcare reform and some of the reimbursement for that, the way that's going to work. So I think they're looking at a very comprehensive analysis of the emergency medical services delivery systems. They're going to look at alternatives. We're certainly planning on being a part of that delivery system, but we'll see what that brings. And they're hoping to get that back sometime around April, May, somewhere in that time frame. And certainly we can give you an update when that happens, or the county EMS can come and give you an update. But it is possible to have a hybrid system like that. It's not something that we've done here, but we have discussed it, and we did offer that as an alternative, which we're going to put a position paper together, if you will, and more thoroughly evaluate that.
Thank you, Chief. And could I just add that when you make your position paper, if there are regulations and rules that are in the way, well, one of the reasons we all ran is so that we're in the rule-making business, rewriting, and also do the rule rewriting business. And we're the lowest level here, but we should be able to tell, and you should be able to tell, which rules you want changed to make and protect our people. Thank you.